Happy Friday, Baylor College of Medicine and friends of Baylor. Well, I want to start off today by everyone take a deep breath. Breathe in, breathe out. I know it's crazy, but my sister's all over me, and I told her we will get through this. Maybe not her, but the rest of us, we will definitely get through this. So the main issues on everybody's mind really are around the Delta variant, kids, schools, breakthroughs, breakups. I don't know, it's crazy. But I remind everybody, no matter what your personal, religious, or political beliefs are, the virus isn't listening. The virus doesn't care. You have to respond to what the virus is doing, and I like to listen to the scientists that know the most about the virus when I make my own personal decisions. Anyway, the rest of the world is a little on fire. There's emergence, obviously, of new cases in Spain, the United Kingdom, USA, Cuba, Georgia, not Georgia, but Georgia near Russia. Botswana still having problems, Kazakhstan, Mongolia, Iran, and Malaysia. So there's still a lot of hot spots. And remember, the reason that's important to us is because when variants emerge in these highly places that have a high viral replication rate, new variants emerge. And we'll talk a little bit about that in a second. You know, I'm always looking for good news. Please let me find some good news. Well, you know, if you look at the UK, remember that huge surge? Well, the UK is beginning to come down now. So it's interesting that the surge went up very high, but also came down pretty fast. So maybe that'll happen here. We don't know. So what's going on in the US? Well, I know you see it every day on the news. Over 100,000 cases, mostly driven by the Delta virus, which we know is 3 to 4 times more infectious than the original Wuhan virus. Florida, Louisiana setting records for cases. The good news is vaccines remain effective against the Delta virus, and deaths are increasing, but at a slower rate, so hopefully we've learned something, or at least we're doing better at taking care of people. And the case rate is finally slowing in Missouri, Nevada, and Arkansas. You know, I listened to the CDC recommendations about wear a mask in highly concerning areas. That's everywhere in the country. So I'm going to simplify the CDC recommendation. Go back to wearing a mask if you're in public, if you're indoors, anywhere, because that's the easiest way to do it. And what's interesting is more and more employers are requiring their employees to be vaccinated, and we hit a milestone which is about half of the country is vaccinated, which is great. If you look at the hot spots, it's getting a little cooler in Missouri and Arkansas, but it's still really hot in Louisiana and Florida. And as I was saying before, if you look at for risk levels, you know, the CDC in high risk areas, well, I love this map because the low risk areas are in yellow. Find the yellow on there. I mean, it's everywhere. So, you know, just go back for the next couple of months to wearing masks in public and indoors. So in the USA, as I mentioned, we are having this spike, but you know, if we follow the United Kingdom, we might be lucky. We are at 50% vaccination rate for the entire population. And if you turn to our friends in the University of Washington, the Institute for Health Metrics and Evaluation, they've been pretty good at projecting what's going to happen. They have two projections. One is the worst case scenario, and in their view, the worst case scenario is we return completely to pre-pandemic mobility, or almost there, and no one wearing masks, which is kind of the way things are, or a reasonable projection where we sort of wearing masks, some people are, some people aren't, and we're not quite back to pre-pandemic mobility. And it's interesting. It shows that if we're lucky, we'll be peaking in the middle of this month. That would be the sharp rise and fall that we saw in UK. If we're unlucky, which would be like the third wave, it'll be more prolonged, and we won't peak until September 22nd. So I'd say probably somewhere in between there. Hopefully we'll be peaking between late August and the first week in September. And as always, hospitalizations follow about 2 weeks after that, and deaths another 2 weeks after that. So in Texas, we're setting new records. We had over 12,000 cases per day this past week, and we're only 45% vaccinated as a state. And we have some new hot spots cropping up. You know, our friends at Dimmitt. I love Dimmitt. I'm going to adopt Dimmitt. I'm going to move to Dimmitt is what I'm doing. But also now Karnes County, we talked about that last week, but Galveston and Chambers County are now new hotspots in the state of Texas. And if you look at the TMC, it reflects everything like everybody else. Our testing positive rate is almost back up to where it was, 14%. Our R numbers above 1, the virus is winning. And our new cases have been, in the thousands. And as I've said many times, well, I'll feel good when it's 40. But in the thousands is no good. And if you look at this number, the 7-day average, it's been really dramatic with over 3,000 cases last week. There's some sense that it might be slowing down this week, but who knows. And again, with hospitalizations, we jumped all the way up to 320. And at our maximum, in the second wave, we were at 360, and in the third wave, we were at 335. So we're getting up to where we were. So I'm always looking at at Israel, because they are the farthest along with vaccination. And we've been trying to figure out about these breakthroughs. Everyone's talking about breakthrough cases and how surprised they are there's so many breakthroughs. Well, it shouldn't be surprising. The vaccine is only 85 to 90% effective. So that means 15% of people are going to get infected who have been vaccinated. So let's look at Israel, because Israel was down to five cases a day in the entire country. They're now having a little bit of a surge, and they're up to almost 3,000 cases. So, they have really looked at their breakthrough cases. So there was a really interesting study that's in press right now in clinical microbiology and infection. They looked at a retrospective multi-center study of 17 hospitals and looked at 152 patients who were fully vaccinated but hospitalized. And that 152 patients represents 50% of the entire country's hospitalized patients who are vaccinated. So they only had 300 total, but they evaluated 152 of them. And just to give you some sense of what goes on, they defined how many of them had a poor outcome. Poor outcome was they died. That's a very poor outcome. Or they were on a ventilator. So of those 152 patients, 38 patients had a poor outcome and 34 died. Now, when you looked at those, 40% were immunocompromised. They had severe comorbidities, hypertension, diabetes, heart failure, lung cancer. Only 4%, 6 patients of that 152 had no comorbidity. So if you think about it, that's a minuscule number of people who got sick enough to be hospitalized and then had a poor outcome, and they had reasons for it. They were in trouble all along. And what they're suggesting is there's a group that we might consider, giving a booster to. So there was another study that was just published. It's actually an early release from the MMWR from the CDC. They looked at this cohort that they've been following called the COVID Net. There's 13 states. And they looked at 7,280 patients over the age of 65. And what they found was that the vaccination rate is effective in preventing hospitalization, 96% in Pfizer, 96% for Moderna, and 84% for the J&J vaccines. And among adults over the age of 75, its effectiveness was still quite good, 91% for Pfizer, 96% for Moderna, and 85% for the J&J vaccine. So very positive news that the vaccines are working to prevent hospitalizations. And there was another publication from Modern Healthcare. They looked at 100 vaccinated people who died in Massachusetts in the end of July. That represented 0.002% of the vaccinated people. So, really, it's such a rare event, and 75% of those had underlying conditions, and the median age of those who died was 82.5 years. So, I'm getting to that age. I'm going to start worrying. I'm going to die from something. Anyway, in Israel, they also looked at vaccinated healthcare workers, another study. Almost 1,500 fully vaccinated healthcare workers, and they found only 2.6% of breakthrough infections that were documented. And what they looked at was they found that in those cases, neutralizing antibodies were a little bit lower. You remember we talked about neutralizing antibodies before. But most of the cases were mild, asymptomatic, and they only had 20% that had some sort of persistent symptoms, and there were no secondary infections. In other words, breakthrough infections in that study didn't yield infecting anybody else. So, that's really showing how effective the vaccine is. Now, we've all been going, because we know that if you're infected after having been vaccinated, you do have virus replicating in your upper airway, your nasopharynx, or your nose, your mouth. And so the potential there to infect others. There's not been a lot of evidence. We talk a lot about it, but there's not been a lot of clear evidence that really has happened. We say it can happen because we know virus is there. Clearly, if you're symptomatic and coughing, you no doubt can pass it on. But if you're asymptomatic, just having virus, who knows? So there was a paper from India and the United Kingdom that was published in Research Square. And they looked at 100 healthcare workers from 3 different centers in India. And what they wanted to do is look at, what was happening. They were all breakthrough infections. And this was, I think, the best data that showed that it might be able to transmit. Because what they did was they traced back each of those people who were infected. They went back to other clusters to see who else was infected. And what they found was in these breakthrough infections with the Delta virus, that the mean cluster, in other words, the number of people who were infected by one person, was 3.3 versus 1.1 before Delta arrived. So it seemed like, at least in this healthcare worker setting, when there was a breakthrough with Delta, they probably were forming clusters. In other words, they were infecting other people. So that was that was kind of interesting. The other interesting thing was when they looked at who was more protected, AstraZeneca didn't do as well as Pfizer. And we sort of talked about that before. AstraZeneca does not seem to be as good in protecting against Delta. So what do we know about Delta? We know it's a lot more contagious. The R number, I've heard on TV talking about it's just as bad as chickenpox. It is not. Chickenpox R number is about 10. The Delta virus is about 6 or 7. Compared to 2.5 or 3. So it's 3 or 4 times more infectious than the original Wuhan virus. There is some suggestion that it causes more severe illness. We know that it produces higher viral loads. There were 2 papers, one from Canada and one from Scotland. Both showed that if you had the Delta variant, you were more likely to be hospitalized than if you had the Alpha or UK variant. And as we've said all along, unvaccinated people are the biggest problem. They're the ones that are at the highest risk of getting the virus, transmitting the virus, and getting sick. And fully vaccinated people, we know that they're breakthrough infections. If you're asymptomatic, except for that paper in India, we don't really know whether or not you transmit to others. We assume you can. But if you're symptomatic, almost certainly coughing, sneezing, and shedding virus at a high rate, you're almost certainly going to infect others. Of course, as long as this virus is replicating, there will be additional mutations. And right on cue, we now have Delta Plus. You can either get the Delta strength or you can get Delta Plus. The Delta Plus has one additional mutation in it. It's a lysine to arginine in position 417. Nobody cares about that. But it's the same one that's in the South African mutant. So we have no idea if that's worse, better. We'll be following that. Right now, it's not present in very many places. It's a little bit in the U.S. and Europe and Asia. It's not very prevalent in India yet. But we'll see. We don't know. So I've been trying to explain to my sister why. She keeps saying, "Why are there so many people having breakthrough infections?" Well, there isn't. So here's one way to look at it. If you have 40 people and if they're all vaccinated, it's 10% are not going to be successfully vaccinated. In other words, 90% effective, 10% won't work. There'll be 4 people who are susceptible. Now, those 40 people meet another 40 people who are unvaccinated. That's like 50-50. That's the United States right now. And if there's only 1 or 2 people in that group of 40, you have 80 people in a group, 4 susceptible, 1 or 2 infected. There's a very low chance that you're going to get the virus. If there had been nobody infected in the unvaccinated group, there'd be 0 chance of getting it. But if there's 1 or 2, it'd be 2 in 80. So that's like a 1 in 40 chance of being infected. But let's say, like it is now, there are more and more people who are infected. Let's say 16 out of 40 people in that group. Now you put the room together. Your 4 susceptible people in a room of 80 and 16 are infected. Well, now your chance is 1 in 5 that you'll get infected. And that's what we're seeing. More and more people, because the virus is prevalent, the virus is finding those susceptible people. And eventually, all those susceptible people are going to get infected. And, by the way, all the unvaccinated people are going to get infected. So get vaccinated, because you don't want to get this virus. This is not a good virus. So a lot of people have been asking about, well, what about protective titers? I've gotten several calls, and people have even sent me their titers. What does it mean? Well, we don't really know, because unlike flu, we have followed flu for many, many decades, and we know if you're either vaccinated or get the flu, we know what your antibodies go up and what happens over time. And what happens is there's a normal distribution. In other words, it's a bell-shaped curve. And if you look at who is susceptible and who gets infected, it's at the very, very low end of that that curve. So the people with the lowest, but it's not 100%. There's some overlap. There's some people that have higher titers that get infected, some people with lower titers that are protected. And so what we've done over the years is try to figure out what's the 50% effective rate. And they've done this with flu, and it's usually, if you take your plasma and dilute it out and see how much does it neutralize, even a dilution of 1 to 40 is about 50% effective. So that shows you what it is in flu. So Dr. Corey and his colleagues in Nature Medicine tried to apply that kind of thinking and logic to all the data they have with coronavirus, because we don't have long-term follow-up. We just have all the studies that have been done for its approval. And they looked at 7 studies, and what they found was really interesting, because they predicted that if you take the amount of antibody you have when you get infected, in other words, convalescent, I've recovered from it, you take out the amount of antibodies, from their calculations, 20%, just 20% of the antibodies that you normally get from being infected protects you 50% of the time. And the other thing is that only 3% of antibodies in convalescent plasma is that level is required to keep you out of the hospital and seriously ill. So that should give you some comfort. You know, as people watch their antibodies wane and people get all nervous, it doesn't take a lot to be able to be protected. And this goes back to our little beaker diagram. Why is that the case? Well, the case may well be because of those memory B and T cells. And so that's really, really an important part. And as we follow out this pandemic, we really won't know the level of antibody that's required to protect until we start seeing people get infected. In other words, breakthroughs in a greater percentage than is happening from what you would expect. So right now we expect 10 or 15% breakthrough. If it gets to 20%, 25%, we'll know then. But we don't know now. So that, people keep asking, when will we know? We don't know. So, we may just wing it and say, well, boosters for a lot of people, but we just don't know right now. Right now, it looks like it's still very effective. So there's a really great paper in Nature that just came out last week that kind of looked at the memory cells that are generated, the memory B cells that are generated after vaccine or infection. And they took 41 people, volunteers, who not only got their blood drawn, but were willing to get take a needle and aspirate from the lymph nodes, which is where all these cells reside. And the interesting thing about a B cell that turns into an antibody-producing cell, it's naive. It doesn't know anything. It needs to be educated. And so what happens in these germinal centers, like a lymph node, very, very interestingly, is that the B cell comes in contact with a cell that's a professional educator, like my sister. A lot of tentacles that is able to present the viral antigens to this naive cell, but it also requires a tutor, and that's a T cell. And between the T cell and dendritic cell, it can educate that B cell into, here's the virus, go get it. And those B cells then become cells that either differentiate and make a lot of antibody, or they go to Oxford and they stay in the ivory tower in your lymph nodes waiting for the future. So if they're challenged with another virus, a similar virus, they'll respond. Well, it turns out these investigators found these memory B cells in the lymph nodes of patients who were infected. So they're sitting there ready. So even if your antibody titers drop, those memory B cells, that's the faucet that turns on, may be sitting there ready to go. So we don't really know how effective it will be, but it suggests that you're all set and ready to fight this virus for a long time. Now, there's a bunch of other important issues that came up this week. People have been saying, what about immunocompromise? Well, there are 2 studies that looked at that. There was one study looking at CoronaVac. Remember, that's the killed vaccine from India. And they looked at people with autoimmune rheumatic disease, and they vaccinated those people and normal controls. And what they found was that the autoimmune people, the folks who had immune deficiency, they tended to have a lower level of antibody generated, but they didn't get sick. So what they're suggesting is it might be effective and maybe they'll need a booster. Then there was a really good study in kidney transplant recipients in the JCI this month that looked at normal folks, people with renal failure on dialysis, and transplant recipients. Well, and that's a perfect control because they have renal disease. The dialysis patients have renal disease but not immunosuppressed. The transplant patients are. So what happened was the transplant patients did not respond very well vaccination with the mRNA vaccines and suggested they probably are going to need a third dose. So that was a new thing. Another really important paper in the JCI came out this past week on pregnant women. So as you know, pregnancy is associated with worst outcomes. So if you're pregnant, you're at risk for worst outcomes from coronavirus. No problems with getting vaccinated, and they found immunoglobulins, IgG and IgM, in the cord blood of the fetus, suggesting that you not only protect yourself with the vaccination, but you're helping protect your baby. So every pregnant woman out there, get vaccinated. And then there was a really interesting study that came out in Kentucky. All these people saying, why should I get vaccinated? You know, I've had it once. Well, they actually looked at 246 people who got reinfected and compared them to 492 controls and found that you're 2.5 times more likely to be reinfected with COVID if you don't get a vaccine after you've had it once. So if you've been infected, get vaccinated. There's a recurring theme here. Get vaccinated. And then there was one question that I get all the time. You know, people from Europe or South Africa who are visiting who've gotten vaccinated with AstraZeneca. They all say, well, should I have my relative vaccinated? Well, there was a study in Germany that did just that. They took AstraZeneca vaccinated folks, gave them an mRNA booster, and what they found was that you got just as strong a response from having the mRNA 2 doses as if you got an AstraZeneca and added an mRNA vaccine. So a really important study. So next time one of you are wondering if your relative who's in an AstraZeneca vaccine needs something, tell them to get an mRNA or another booster. And then the most important thing that's been coming up lately is pediatrics. I mean, everybody's worried about kids because we're going back to school. It's a problem. You know, as of August 5th, this past week, nearly 4.3 million children have tested positive for COVID, and that's just 94,000 children in the U.S. tested positive last week. That's a huge number of kids. And right now, children make up about 1.5% to 3.5% of all the cumulative hospitalizations. And there's a consortium of 23 states in New York City that have looked at all these cases, and about 1% of cases get hospitalized compared to, let's say, 9% of adults. And the case fatality rate is low, but it's higher than most things. It's 0.4% for kids versus 1.1% for adults. So not as bad as adults, but still a lot. And if you put it in perspective, there have been about 400 kids that have died from COVID. Compare that to a flu season where it's usually half that number to a third that number. You know, and it's not over. So we need to do a better job protecting our kids. And the kids are in the middle of a giant surge as well. It's the third spike, or just like everybody else. Fourth wave. Sorry, can't add it. We got COVID of the brain. And okay, time for my favorite time. It's our Olympic update. So there's no question Japan lost the Olympics. And the Olympics won. Actually, it's funny. Japan has a giant surge, and only a few hundred athletes actually tested positive. So if you look at it right now, Japan is testing about 18% positive as a country. They're in the middle of a surge. There's no question that having the Olympics didn't help them. I think they're the happiest people on Earth to see all the athletes leave. And speaking of super spreader events, not just the Olympics, Sturgis, it's back. It's back. Part 2, Sturgis Part 2. 700,000 people heading to South Dakota's Black Hills for the motorcycle rally. You know how every year they come up with a slogan. I love it. This year's slogan is, we're spreading our wings. It should be, we are spreading our virus to you in South Dakota. I just can't believe it. Anyway, so they're going to have a giant outbreak. There's no question about that. So these people who figured out the total number of cases, I mentioned this last week, probably 266,000 cases were generated out of Sturgis Rally 1. If you looked at the total cost of the healthcare system, it was about $12 billion. So each corona case that was generated out of the Sturgis Rally cost $46,000. So I'm thinking, just pay everybody $20,000 to stay out. We'll save money. Anyway, I want to finish with some shout-outs. Thank you, Governor Abbott, for helping us find nurses. If you can find them, good luck, send them. We need them. We have beds, but we need staffing. I want a giant shout-out to Raymond Martin. He's our Paralympian. He's a first-year PA student, 3-time Paralympian. He was in 2012, 2016, 2020 now. He's 7-time medalist. He has 6 golds and 1 silver. We expect him, of course, to come back with another medal. And I don't know what the rules are, but you better be wearing Baylor College of Medicine swag. better be doing that. And by the way, I want to have even the biggest shout out to parents, teachers, principals, and government officials who are desperately trying to keep our children safe with no help from us. So with that, I want to end. Have a great weekend, and I will see you next week. Okay, come on, Lily. Let's go, come on. Let's go, sweetie. Oh, time to go.